A common question we get is, should I stop any medicines prior to surgery? And the answer is no. Um, a lot of folks are scared that, what if I don't stop my anticoagulation medicines, that I might have a lot of bleeding during the surgery. Well, there's really not going to be much bleeding at all. We do the surgery. It's a bloodless surgery. Certainly for other surgeries through skin and deeper inside the body, makes a lot of sense to stop or bridge your anticoagulants to something else in the interim. But for the eyes, we make clear cornea incisions. There's no blood vessels really in the cornea, and so we don't anticipate that there's going to be any bleeding at all. And another question I get asked sometimes is, should I stop my immunomodulating medicines? And these are going to be patients, doing chemo, cancer patients, patients with autoimmune disorders. And the idea is that, a lot of these medicines that these patients on suppress the immune system, and so again, with other larger complex surgeries, you're theoretically more prone to infection afterwards. But again, the eye is immunoprivileged, which means it has its own, immune system separate from the body's. There's a blood-eye barrier. No, you don't have to stop any of those medicines either. Are there any other medicines that I get asked about? Some folks ask about random medicines, but the answer is almost always no. You can just keep going with your medicines. The benefit of you taking your prescription medicines is far greater than any benefit to the surgery for stopping it. All right. Other questions we get is, should I stop any, which foods to avoid, or none. Just have a light breakfast, come in for surgery. If you eat too much, the anesthetics may take longer to work, or you may have to take more to achieve the desired effect. So just a light breakfast is good. Again, this is not general surgery, so of course, in general surgery, you don't want to eat anything at all because you're going to be paralyzed. There's a chance you're going to vomit from just the paralysis, the hard anesthetics that put you under. But we're just doing light sedation. You're fully conscious. You can be sleepy, but you're breathing on your own. Your bodily functions are as normal. I don't see any problem with eating a light meal. Maybe hold off on the coffee. That might slow down the sedation process for you if you're stimulated when you arrive. Other things. One thing that sometimes I get asked is, should I stop my eye drops, eye drop medicines, whether prescription or not? And the answer is almost always no as well. In fact, we highly encourage you to use your dry eye drops prior to surgery. So the week before surgery or 2 weeks before surgery, go ahead and use your Refresh Sustain artificial tears preservative free as much as you can. That's 4 times a day to 8 times a day, both eyes. The more you can optimize your cornea, the less likely you'll have that dry eye sensation or that bout of dry eye that's temporary after surgery. And it also promotes for faster healing. During surgery, we use a lot of disinfectants that irritate the eye, and so if your cornea health is optimized, those disinfectants, betadine, doesn't do as much, doesn't wreck your cornea, so to say, as much. So that helps. Continue your glaucoma drops. Continue all the other drops that you typically take. That's all very important and doesn't affect the surgery whatsoever. think that about covers it. Thank you.